Great. Welcome, everyone. We're delighted to have you here and join us for this first kickoff of the Guest Neurologist program. I'm Roy Strowd, a neurologist and neuro-oncologist at Wake Forest School of Medicine. I'm going to introduce our session and our just outstanding speakers that I'm so excited for you to hear from and be able to interact and talk with. But before doing that, I want to give you a little bit of an idea of what this session will be like and what to expect. This is going to be a fun conversation, so very informal. You're going to hear from a fantastic neurologist and an outstanding medical student going into neurology, and we hope to excite you with three things. One is I want you to leave this hour wanting to be a neurologist, or maybe just excited to go into healthcare in some way, and we'll talk about what neurologists do and how you get there. Two is I'd like for you to have some connections to neurologists and medical students and health professions trainees in North Carolina, and you may end with 1, 2, or maybe even 3 email addresses of folks you can contact after this to continue some of your interest and connections in our field. And 3 is I'd like for you to ask some questions about your future and what you want to go into, and that may be big career future, what kind of area of medicine you're interested in, or things that are more proximate, how to get into med school, or what is PA school, and we'll talk about some of those things. So all of those questions are fair game. The way this session is going to work is we'll start with a short kind of 15-20-minute interview, and you'll meet our 2 panelists, who I'm going to introduce in just a second. And while they're talking, I want you to be thinking about questions that you have for them, about their life story or how they got to where they are, why they did what they did, and where they're headed, or just what their day is like and what types of patients they see and gets them excited about. Then we'll open it up to just general question and answer. You can type your questions into the Q&A. And we'd love to bring you on video, and so if you're willing and able to come on video during the last 45 minutes, we'll go through questions and talk with you and interact and hear what you have to say. So with that, I'm going to turn it over to our panelists. We have 2 phenomenal people to walk us through this guest neurologist session. With us is Dr. Nina Browner. Dr. Browner is awesome. I love her. She is Associate Professor of Neurology at UNC School of Medicine. She is a movement disorder neurologist, and you'll learn about what that is and what she does. She is also the Vice Chair of Education at the UNC Neurology Program, and just a great person and an all-around fantastic educator. Here with her is Suzan Farris. Susie is one of the senior medical students, a 4th-year medical student here at Wake Forest School of Medicine. She is going into neurology, so she made some great decisions with her life and just matched, and she will be staying here at Wake Forest for her neurology residency. So we're pleased to have them both here. And with that, Susie, I'm going to turn it over to you and Dr. Browner and to get us started.
Thanks so much, Dr. Strowd. Usually when I start these sessions, we just introduce ourselves a little bit. Dr. Strowd did a great job of doing that, but I'm Susie. I am here at Wake Forest. I'll be here at Wake Forest. And the first thing I wanted to do is just to ask Dr. Browner to tell us a little bit more about herself.
Hi, everybody. Thank you so much for introduction. My name is Nina Browner, and I am a neurologist at UNC. So I am a movement disorder specialist, which is basically a subspecialty of neurology. Neurology is very interesting part of medicine where we have different types of subspecialties and we see specific types of patients. And so I am actually, this is my first job at UNC. I'm here since 2008. You can imagine how much I love what I do because I never moved anywhere. I'm kind of like stuck to it, but I've been around. From my accent, you must probably realizing that I haven't had medical school here in the United States. I have never went to college. So now you'll be looking at me like, how is this person here? But I think that our love for neurology comes from very different walks of life. And so I think it would be interesting to know how people arrive to neurology, even if they haven't really went through the undergraduate specifically or specifically through a specific medical school. So
can you tell us a little bit more about how you got interested in medicine and in neurology?
Absolutely. So my whole family is from Republic of Georgia, which is Soviet Union Republic next to the Black Sea. And I lived all my life in Moscow, which is a humongous megapolis, 9 million people, lots of different things happening. I have to say that I didn't know that I'm going to be a doctor from very beginning at all. at all. I will not repeat all the iterations of different professions that I wanted to go to, but I think that one thing that was obvious that I really wanted to help people. That was my idea, and I wanted to work with people. And then as I became a little bit more older, I realized that I'm very interested in people. I'm interested in how they speak, how they talk, what motivates them, why they make decisions that they make. At that moment of time, it was obvious that medicine would be the way to explore this further. The trick was that back in Russia, to this day, you do not have college. And so at 18, you have to make this humongous decision about who you're going to be for life. And because you immediately get into graduate school, which is basically higher education, and you take entrance exams. And the medical school is usually structured for 3 years. You do all the preclinical type of subjects, and then the other 3 years you do clinical subjects. So do not worry. We have our fair share of different types of chemistry that we all love and attend to those classes. And so the decision was to become a doctor. It was kind of like a very specific decision. You had to prepare for exams. So we do have the entrance exams. And after that, it was very smooth sailing. Again, I didn't know I'm going to be a neurologist. If you know me, you know that I'm going to be very open to all these different ideas, and I would explore. But I think the first time when I realized that it's really cool is when we have this neuroscience so-called block. It's actually lasted for a year and a half in Russian. Yes, it's a year and a half. You kind of like learn all the pathways, you learn the brain and so on and so forth. I fell in love with the logic of it all. I really loved it. I thought that the logic was amazing, how everything is packed, how you can figure out things, and where the problems are, and the brain is basically creates us, who we are. I love the combination of science and art. Right? Isn't it right? So I feel like as a neurologist, it's so easy for us to lean into this completely uncomfortable subjects as, for example, stigma, or uncomfortable subject of, for example, death or near-death experiences, coma. We also very proficient in conversing about dreams and what happens during the dreams and sleep. And so I love the use of philosophy a little bit, and arts, and you know what I'm saying, like just kind of like beliefs and myths that people would have, and then you either agree with them that you also do not know, or you actually say, well, actually we have the answer to this question. And then I cannot underestimate mentorship that happened to me. So I don't know, neurology is extremely interesting profession. We truly are apprentices. Have you thought about this? Yes. Apprenticeship is something that is very, very interesting point of neurology, because comparing to other parts of medicine, I think that watching somebody do it, or doing it yourself, or doing it several times, figuring out the tricks of the trade of the exam, really be hands-on with your exam, being able to converse with the patient, as I said, in all of these interesting parts where maybe it's uncomfortable to lean into. All of this comes with experience, and all of this comes with mentoring, like you are mentored. And so mentorship and apprenticeship is extremely common in neurology. And so for me, I end up having the mentor. I end up falling in love with 86-year-old man who happened to be a very famous professor of neurology in Russia. And we had tremendous fun. And I also, my medical school had a neurology block. So we had to do clinical neurology. And I think that exposure to neurology was invaluable, but then he was also there. And so as a medical student in the 5th and the 6th year, which is the last 2 years of medical school, I actually finagled and talk to the surgeons to let me go sooner from the surgery rounds. Can you imagine this? This is really, so that I could attend neurology rounds and enjoy seeing patients, continue to see patients in neurology ward. And it's a very interesting system. It's not like we have here in the United States where we have rounds with the patients every day. The rounds would be happening almost twice a week. So the surgeons were okay. And what was very interesting, that my mentor was so well known and so well loved, adored, that the surgeons were saying, where would you go? You go, absolutely go. I was allowed to go and be there. And I think the next person who was really teaching me a lot is the patient themselves. The apprenticeship comes from the mentorship and from the patients. And so that was very interesting. And then I did my residency there for 2 years, and I did the research, and I decided that I'm going to apply for this absolutely ridiculously competitive scholarship that at that time President Boris Yeltsin was giving out to 1,000 scientists in Russia. And I thought that I could be that 1,000 scientists in Russia who could go. And so I received that scholarship, and I sent scholarship to do science outside of at that time it was Russia, not on Soviet Union anymore. So I sent 40 emails for all of you guys out there who were trying to figure out how to connect to neurologists and how to move with your career. Here's the math: 40 emails, 3 people answered. In one, I went to do something. You understand? So you have to be very persistent, and you really kind of like have to like say, I would like to be with you. I would like to work with you, and write an email and basically connect to people. And so I came to Johns Hopkins to do a 2-year of research. And at that time, it was a very hot functional MRI. I don't know if you guys know what functional MRI is. It's basically trying to understand not only how the brain looks, but how the brain works. And it was very, very beginning of functional MRI, and nobody really knew what they were doing, but it was really cool and exciting. And so then after that, I went to my residency, which is in neurology. And then I have a separate story about how I decided on movement disorders, but I think I'm talking too much. So Susie, please take this one from me.
You're not talking. I mean, my next question was going to be, how did you decide on movement disorders? So you're doing great.
Oh, good. So I have to say something that I think that the decision of who you want to be within the medicine is actually a very important decision. And I don't want to stress everybody out. We have 45 people who are most probably completely now, oh my God, this is the most important decision of my life. I think what it is that it's trying to match your personality to what you want to do. Does it make sense? Like, I think that medicine overall and requires you to be very thoughtful about who you are. And so I tell you my story, and you will realize that how I didn't know who I am. First person here. So I actually was fascinated by epilepsy. I was fascinated by the epilepsy patients, because what I really loved is the idea that from the conversation of the patient, I could figure out where the lesion is and where the seizure is coming from, because people during the seizure would do a very particular movement. So they will smell something, they will see something just before the seizure happens. And that localizes to a particular part of the brain, was very much connected to functional MRI that I was very interested in. And so when I went to residency, I actually went to the very, very strong program in Cleveland Clinic, Ohio, where they had a humongous epilepsy service. They were doing surgery, they were doing everything. And I am a resident, and I'm a 2nd-year resident, which is basically you are in the midst of your neurology, like you are right there in the middle of all of it. And I'm having the rotation where I see a lot of epilepsy patients, and I love talking to them. I am there asking questions. How is your seizure? Where, how? We're all about stigma. We're all about how social aspects of it. I am completely excited. And then my attending says, and by the way, now we need to go look at the EEG. And the EEG is basically ability for us to put the electrodes on the skull, but hear the brain waves. And I go to the room with this EEG, which is basically looks like a lot of wiggly lines everywhere. And I sit there for a day, and then the 2nd day and the 3rd day, and I realize that I don't like it. I just know it's not mine. I am back into the patient room asking them all these questions, and people are saying, like, you should look over here. Look, here's the seizure. And I'm like, no, I know, seizure's over there. And so there was a huge dissonance. And I realized that I'm not going to be able to do it because as an epileptologist, which is a person, it's a basically subspecialty of neurology who's interested in understanding seizure disorders and how to treat it, they are very much doing a lot of what's called neurophysiology, which is basically understanding brain waves and understanding where they're abnormal and so forth. So here's the realization: you're a second-year neurology resident, you've done your medical school, you've done your time with research or gap year, whichever, you went into neurology, and you arrive into the time where you're realizing that what you thought you're going to be, you cannot be. And for anybody of you here who sometimes loses the direction, I know the feeling. It's kind of very much of a bottom. You know, you thought that this is what you are, and then you realize that, no, that's not what I want to do. And how do I get back into the saddle? And again, mentor. So the same attending with whom I was, who realized that I actually like to talk to the patients rather than do neurophysiology. He looked at me, he said, why are you so upset? I think you found yourself. And I was like, no, I've lost myself. I do not know what I'm supposed to be doing. And he said, no, you found yourself. Your ability to depict exam and really connect to the patient and really talk and diagnose is actually something that is very much is primary neurologists do. And then you should do movement disorders. You see what I'm saying? And so movement disorders is actually very much apprenticeship. You cannot read it in the books. You have to watch how people move and what movements are abnormal. And then you need to classify that just by looking. We have no tests whatsoever. We sometimes may do the MRI if we would like to. And basically who we see is people with Parkinson's disease and tremor and dystonia and functional movement disorders. It's a very interesting patient, and you learn by being an apprentice, watching them, watching your mentor. And so that's how I arrived to who I am. Yep.
That's awesome.
Lots of bumps, right? Lots of bumps. For all of you there who are listening, don't worry about the bumps. Bumps are good.
I had some bumps too.
Yes, we all have bumps. You're supposed to have a bump. Wait, we cannot see you. You're muted. Right.
I am muted. I was double muted. Thank you. It's great to hear. No, that was we all have those kind of bumps as we get through, and great to hear. And Susie, thanks for those questions. Susie, can you talk a little bit about your path? You're not quite there yet of choosing the spot in neurology, but you have picked neurology. How did you get here? You know, what were you thinking about when you were in college and figuring out what to do? How did that go for you?
So I actually graduated from college about 15 years ago. I graduated in 2006 with degrees in psychology and religion. And I decided that I was going to go to graduate school for psychology because at the time, medical school sounded like a very hard, scary thing to me. And I thought I might want to do it, but maybe not right then. And I went to grad school for psychology, and it just wasn't for me. It was a primary research program, and I got really interested in neuroscience while I was there and started studying EEG and fMRI. But I decided I didn't want to get a PhD, and I didn't want to teach at the college level. And so I left my PhD program, and I got a job doing clinical research at Wake Forest here. And I started in imaging, and then I went full-time in psychiatry, and I did psychiatry research for a while. And then I thought, I think I probably will go to medical school. And at the time I thought I was going to be a psychiatrist. And then I ended up needing to change jobs because my boss actually left the institution. So then I did fMRI research for a few years, which I loved. And that job had the flexibility that I was able to take the prerequisite courses I hadn't taken while I was in undergrad. And then I applied to medical school and got into medical school. And then I was still not sure whether I was going to do psychiatry or neurology. And then I did my clinical rotations, and that really sold me. When I got to neurology, I just felt like I felt like I found my people. who thought about the world and about patient care the same way that I did. And so here we are. It worked out.
Absolutely.
Fantastic.
Absolutely.
Yeah, I think for most of us, for a lot of us, it's not just one straight line into medicine. There's a lot of wandering and figuring things out, and I think for the students listening, that figuring and thinking is normal, and sort of figuring out what you're passionate about, what you really like, exploring that for a little while, and if you change your mind, change your mind, and both of you, I think, have underscored that. Great.
I just want to add something. I just want to add something. Actually, when I think that we a lot of times tell people it's a lot of exploration of yourself, and sometimes people feel like cringe, like, oh, do I have to do this? I already know where I am, right? But here's my example to you. At 8 o'clock in the morning on my clinic day, which means that I'm at home and I'm packing lunches for my children and trying to get my husband out. I do not want to be in my clinic at 8:30. I do not, because there's too much things going on and it just like becomes like too much. But at 8:45, the moment I sit down and I start talking with my first patient, I love it. I love it. You understand me? I think that this is the best thing that I could do. And I know that a lot of my residents who rotate with me, like, this is impossible to be with you in a clinic. You're so happy all the time. But the idea is that you found who you are and completely matches you, and you able to find yourself within the medicine. And a lot of people talk right now about how hard the medicine is to practice and how much how much is it at stakes to get into medical school, to go through the medical school, to kind of like not to burn out, not to get jaded. And I think the way to resist that is to basically be able to know exactly who you are and match yourself to where you want to be eventually. And then burnout doesn't, if it happens for 15 minutes between the lunch packing and the clinic starting, right? And when we drive in the car, but then immediately when you're there, you're like, yes, I'm happy. I am here with my tribe, with my people, right? And so life is good.
I think it's ideal to be in a situation where you can be completely yourself, both at work and at home, because you never want to leave either. I think that's a great thing. So I think we're going to start the Q&A from the students, and we're going to start with one from DeAndre Guyton. I'm sorry if I said that incorrectly. And he asked, what are the many different subspecialties of neurology?
Oh, I love this question.
Let's see if we can get DeAndre up. Hey, DeAndre.
Hey, how y'all doing?
Hi, DeAndre. I love your question. This is very good. In neurology, you actually can be anybody you want to be. There's lots of subspecialties. For example, if you love something doing really fast and quick to make a decision on the spot, there's vascular neurology for you. This is the people who take care of acute strokes. And I hope you heard that there's this clot busting medication now that we could reverse the stroke completely. And so there's a lot of people who love doing that. The same goes for ICU, for example. There's now neurological ICUs where people are with neurological conditions need a lot of care, and you have to make decisions very fast. There are people who love to do physiology, physics, and these are people usually who like to do epilepsy, for example, or listening to the muscles and how muscle work, for example. These are people who are neuromuscular specialists, and they're spend their day seeing patients and then doing a lot of the procedures in regards of like doing this neurophysiology, listening to the brain waves or listening to the muscles, for example. We have Dr. Strowd, who is basically interested in neuro-oncology. That is completely changed in the past 5 years, I feel, and and started going to a little bit of the immunology or neuroimmunology and kind of like really thinking about how much immune system works inside the brain. And the other people that we have like this, a neuroimmunologist, which is taking care of multiple sclerosis and all the other autoimmune neurologists. And then you have us, the pontificators, the people who do movement disorders and behavioral neurology, which is taking care of dementia. and these are the people we usually are living in ambiguity. We hardly ever have a diagnosis pinned down immediately because we don't have very much of a precision, but we're okay with that. So as you can see, DeAndre, that's why I love your question, is that within neurology, you actually can find yourself immediately depending to who you are and what you like to do. So this is really, really, really welcoming and a very, very diverse part of medicine.
Thank you for that, Dr. Browner. I think next we have a question from Benjamin Leach. And I think that we are able to enable video for our attendees. So Ben, if you want to ask your question live, feel free to come on and do that.
Sure. Can you all hear me?
We can.
Yep.
Yeah. Okay. I'm actually on my phone, so I'm not very experienced with Zoom on my phone, so I can't see how to get my video on. But yeah, my question is essentially just the difference between a psychiatrist and a neurologist in terms of the patients you're seeing, because I've taken like an abnormal psychology class and hear about a lot of mood disorders, and I see a lot of crossover there with psychiatrists. But then like I've also taken some neuroscience classes that dealt heavily with like movement disorders and speech disorders. So anyway, thank you.
Ben,
Great
I
question,
love this question. Great
Benjamin.
question.
Before we answer, and Dr. Browner is going to have a great answer, where are you coming from?
I am in North Carolina right now at Davidson College.
Great place. Yeah. When you come on, please let us know where you're coming from. We'd love to know. Sorry to interrupt, Dr. Browner.
Oh, no, it's okay. I think that psychiatry always comes up. Look at Susie, right? So for you, it was thinking about between psychiatry and neurology. And I do feel that both of them, actually, long time ago in 1900s, there was no psychiatry or neurology. There was a neuropsychiatry. There was a guy, his name was Charcot, who basically, what he did is he's practiced neuropsychiatry, but what he did is that he basically found the way to show that some of the disorders come from the brain, and you actually tangibly can see changes on person's body or exam. And he called those disorders neurological disorders. And then he basically said the disorders of the psychic is basically disorders that basically cannot be seen in the body per se. And he called it psychiatry. What's very interesting that his one student was Sigmund Freud, and the other student was Gilles de Tourette's, who basically discovered tics and Tourette's syndrome. And you can tell immediately how there was a dichotomy between the two, neurology and psychiatry. I think that I agree with you completely, Ben, that both of them are completely married together. We see we do a lot of psychiatry, actually, I feel, as neurologists. And many times, a neurology exam needs to be done by a psychiatrist, to the point that when you are trained in neurology, you're supposed to be 1 month in psychiatry. You actually have training in psychiatry as well, and vice versa. The psychiatrists have to spend time in neurology and learn about neurological conditions. I think the difference is that with psychiatry, it goes much more into disorders of the psychic, such as schizophrenia and bipolar disorder. Whereas in neurology, we deal still with a lot of the issues of the neurological exam and body and the brain dysfunction. Does it make sense? But one more plug with functional MRI, if I may. The functional MRI is actually where both of them are converging again together, where we're realizing that even for schizophrenia, that well-known disorder of a psychiatrist, right? We know changes. We see changes in the brain development and in brain functional ability. So very tangible changes in the brain that creates the psychiatric symptoms. So to be continued. Yeah, to answer for you, Ben, to be continued.
Thank you so much.
Sorry. I wrote a review several years ago about language pathway differences that have been found in patients with schizophrenia. So they actually have differences in their brain structure that we've been able to find, which just underwrites the close relationship between neurology and psychiatry. Anyway, thanks for that.
Yeah, we see a lot of students who are interested in neuroscience in general psych and neurology or neurosurgery or neuroscience, all those things in college. And I would just encourage you to keep pursuing that passion. And then as you go through, oftentimes then you kind of figure out, oh, I kind of like psychiatry, oh, I kind of like neurology, or maybe I like neurosurgery or those things. So, so great job, Benjamin. Keep exploring that passion.
So I think our next question is from Carter Bell. Carter, if you want to come on and ask your question.
Hi guys, I lost my voice recently, so I'm sorry, but I'm calling from Wake Forest, which is in North Carolina, obviously. My question was, what do you guys recommend to do during a gap year? I've asked differing specialties, and I'd just like to hear what you guys have to say, because I'm more inclined to get a job and earn money, but if it's more beneficial to do something not geared towards income, maybe that would be better. I just want to hear you guys' opinion.
Well, I took 10, so I have a variety of answers for this question, but I think Dr. Strowd and I have actually talked at some length about this before, and I think that if you want to do something that's really important to you, then taking a gap year is great. The most important thing is that you know who you are and what your priorities are when you go into applying to medical school. And so if setting up some financial stability for yourself and being prepared to handle any unexpected financial challenges that you might encounter while you're in medical school is important to you, that's something that you could talk about on the interview trail, which would make working in almost any job a totally reasonable thing to do during a gap year. Some people do research on something that they're really interested in. Some people do service work, they do the Peace Corps. Some people work as medical scribes to kind of get some exposure to the medical field directly. And all of those things are great to do. The only thing I would say not to do is to hang out and play video games for a year, because it's not going to be something that can be talked about in a stimulating and interesting way in a medical school interview. How's that?
Thank you. That's helpful. By the way, I don't see any option to put on my video camera at all, so I think it might be like the limitation of the meeting, not people not wanting to show their video.
Thanks for that.
Thanks, Carter.
All right. So I think our next question is from Jacqueline Palermo.
Hello, I'm from Wake Forest, and I was wondering what you wish you did to prepare before you arrived at medical school.
Dr. Browner, do you want to take this one first?
I think that I'm going to reflect on Carter's question as well as Jacqueline's question. I think that in medical school, what happens is that I think that we commonly, as a medical students or student doctors, as we call medical students, right? We commonly thrusted in quite sometimes very challenging situations. And Susie, correct me if I'm wrong, right? Because we end up, you know how it is, there is something very, very special about relationship between a doctor and the patient. And in medical school, especially in the clinical years, which is a third and fourth year, and I would say in many medical schools, they expose you immediately in the first year as well. You preview to these conversations, and these conversations can be quite uncomfortable, and sometimes they could be sad, and sometimes you have to dig somewhere out your own personal life experiences, or if you don't have one, books experiences or anything else experiences to really connect to the patient and validate what they're talking about. And I do feel that I think that preparing to medical school means in a way also expanding your horizons. And I always feel that just taking only pre-med classes, it's great, but I think that I would love to take women's studies. I love, for example, that Suzan took religion, because I think that comes up so many times, not in a specific way, but philosophy of it, understanding of it, because you continuously thrust it into conversations that don't have the real answers, and you sometimes have to have some kind of framework to how to converse. And so the more you expand your horizons into liberal arts, I think, the more soul maturity, as I call it, comes, where you can actually give something back to this relationship that you are going to be building with patients as a student doctor, and then eventually as a resident, and then eventually as a full-fledged practicing physician. That's my answer would be.
So I think I can echo that. I think that the time that I had between undergraduate studies and medical school allowed me a lot of personal development, and I took that and made the most of it. But separately from the personal development of just growing up and being able to interact with people and really relate to other people and think about big picture ideas, I don't think there's much you can do to prepare. Going to medical school is getting thrown into the path of a fire hose, and it doesn't matter what you do, you won't be ready. It's going to be a big adjustment. And I think the best thing that you can do is enjoy yourself and make sure you feel really solid as a person going in.
Thank you.
You're welcome. Okay, so we have Indira Tapias and Yasmin Hosami. And I think we're gonna hear from both of them.
Hi.
Can you hear? Oh, sorry, go ahead.
Sorry. I just wanted to know how right now, after working in the specialty for a while, how you feel about like the work-life balance in the specialty.
It's a great question.
Yasmin, you had thanks, Indira. Where are you coming from, Indira?
Oh, I apologize. Right now I am in Greensboro, North Carolina.
Fantastic. Thanks for joining in your question. I think, Yasmin, you had a similar question. If you want to ask it, I think they're both related.
Yeah, hi, my name is Yasmin. I am from Raleigh. I go to NC State. Similar question, especially since Dr. Browner, you said that, you have a family, you have kids. So how, and, something for me, family is important. I don't want to be absorbed in my work all the time where nothing else is as important. So how do you manage spending like adequate time with your family and your kids and being a part of their, upbringing, as well as practicing medicine, which is your passion?
Oh, thank you so much for this question. That was a great question. And I think that many times when we do any mentorship, we forget that people have other lives and they would want to have children and they want to get married and so forth. So I have to say that I actually never thought about that I should postpone anything in my life. So I had my first child when I was a resident, which is a humongous no-no if you listen to most of the residency experiences. But we were madly in love with my husband. We saw each other. We met when I was at Hopkins, and we decided that we want to start the family. We didn't want it to wait. We did it. We had to hire a nanny because none of the preschool would ever have the time and hours that we needed to do between my residency and his job. And we always had to juggle. We always had each other. There were a period of time where when I was already in attending, I would have my car ready in a garage with my child, and my husband will pull up, I will give him the baby and I go because I need to be in clinic, for example, or I have to be at some meeting before we could do it all virtually. I think that number one priority for me was always that I will do it. I will not postpone it. And number two, I think I was very fortunate to have this amazing partner in crime, who is my husband. And I also had a mother who always worked. My father always worked. And so I assumed that this is what parents would do. And I always knew that this is something that we will be doing. And as a now faculty, I could actually figure out the time. And when my son was very much into robotics and he was a captain of the robotics team, I was a coach of the robotics team. Imagine me, robotics team, no go, but whichever, I did it. I just basically moved my clinic, half of my clinic to another day so that I could be with them during the robotics competition and everything else. So I just very, very organized. It's very, very doable. It's very, very doable. I think that you just have to jump in and say, we're doing it. Both of us are doing it, and we will enjoy ourselves doing it, and not having a guilt and asking and creating imposter syndrome about like, I'm not doing it well enough as if somebody else. You're doing it amazingly well. And so, yeah.
Yeah, I got to jump in there too, Dr. Browner. That's a great answer. I think neurologists have a great life. I love life as a neurologist. I mean, it's great. You love what you do. I think as you see us, I mean, we're happy. We're in the middle of a work day. I'm like answering pages on patients and things, and but I love being with patients. And it is a commitment, and this is a purpose. You know, you come into medicine, and that's your purpose, and you do it, and you're taking care of people, and there's a privilege to that. There's also a lot of responsibility. But we all have families. I have 3 kids. I coach soccer for my kids and do that same kind of handoff and those things. And we also had, my wife and I, who's a dermatologist, had our first child in residency and the second one in fellowship and then the third one, right? So, you know, you do that and you just do those things. But life as a neurologist is great. And there's, you know, balance is tough. It's not kind of a 50-50 even thing, but we all integrate our life into our work and our work into our life. And as you see from the 3 of us, we love what we do.
That is absolutely true.
I also want to say one thing. So for Indira and Yasmin, I know that as a woman, it's sometimes very hard to see yourself as a physician. I would like you to really consider to be a physician, absolutely 100%. And also wanted to say that, you know, it's very interesting. We talked about that career pathway is not straight arrow. You know, actually life is not a straight arrow. And so you could potentially sometimes stay back and until when the children are small, for example, and do the part-time job, which is very, very common in neurology, you know, and then when they're a little bit older, you could jump back in and step into the leadership roles or whatever you would want to do. This makes sense. So it doesn't need to be happening all at once. I have to be this and this and this and have multiple hats. It could be sometimes you pay more attention to your family and sometimes you pay more attention to your professional development. But I think that I would love you to choose medicine. I would love you to choose medicine. We need more strong women in medicine. And I love your question tremendously.
Thank you so much.
I think I really appreciate that. I know for a fact I want to go into medicine. There's nothing else I could even imagine myself doing.
Perfect.
And, you know, even though my family is really supportive, you know, still it's like, oh, you're a woman, you need to have children, you need to make time for that. But anyway, I really appreciate your input. Thank you.
Yasmin, give them me as example. I had 2 children. Everything is fine. He took SAT last week. It worked. So it's all good.
Thank you.
Thanks, Dr. Browner. Our next question is from LaShawna Curtis. LaShawna, are you on?
Yes, I am. I'm LaShawna Curtis. I go to UNCW right now, and I did the military first, so I'm very non-traditional. So I was just curious if you had any advice. Thank you.
Okay.
LaShawna, great question. I think that's, do you have any advice for non-traditional students applying to med school? And Susie, you may have some thoughts on that one.
Sure. So I think I was 30 when I applied to medical school. And as a non-traditional student, there are resources that you can use. You're in college now, and so I'm sure you have a pre-med advisor that you can use. I didn't do any of that. I decided to do everything by myself, which worked out fine, but I probably made things harder on myself than I needed to. As a non-traditional student, just highlight your strengths, highlight your professional background, highlight your maturity, the fact that you know who you are, that you have experienced hardship, that you have endured in the face of having a lot on your plate at one time, managing your life and your finances as an adult going through college. You're already doing that. If you're financially independent, having been in the military, then you are well prepared to go ahead and do that again as a student in medical school. I think that was actually one of the hardest things for me, transitioning from being a working adult to being a student again, was just trying to handle having a house and dogs and a car and things like that. But my advice for you is make sure you're financially stable and highlight your professional prowess and your background and the things that you learned about yourself and the world while you were in the military.
Great answer. Yeah, I love working with non-traditional students. I think that background that the students tend to bring is very rich and adds to. You don't have to be a non-traditional student to have a rich background, but I certainly think we see that. Great answer, Susie. Great question, Lashana. Thanks. I think our next question is from Billy Matthias. Billy.
Hello.
I can hear you.
I'm from High Point University, and I was wondering what kinds of opportunities for research are available in the field, whether that be therapeutics or just new ways to diagnose patients.
So in what capacity are you looking to get involved in research, like as a student or as a job, or just sort of peripheral involvement?
Or inspiration?
I just meant you guys, like as working physicians, do you participate in research with your patients?
Yeah. So research in medicine is huge, right? We have everything from people who work with cells in tubes in another building to doctors who give patients novel treatments that are in testing to see how safe they are or how effective they are. And there are a lot of opportunities for that. I don't even really know how to expand upon that. Dr. Browner, do you want to speak to that a bit more?
Oh, yes, absolutely can jump in. Billy, thank you so much for your question. This is a great question. And I think that it's very fun to answer this question today, and I'm sure it's going to be even better to answer it 10 years from now, because here's the example for you about the research is that I do not practice the same way that I was trained. And I was trained 10 years ago, or maybe like 12 years ago, because what's very interesting in medicine right now is that there's a lot of interaction between what's happening in research world to the clinics. And for example, Dr. Strowd can tell you that we right now taking care of the tumors of the brain quite significantly different compared to, for example, 20 years to 30 years ago. In movement disorders, we have deep brain stimulation. We literally stimulate parts of the brain and improve people's function to the point that they get their life back. We are considering doing this right now for our epilepsy patients to prevent them from having more and more seizures, and seizures that would not respond to medications. We are creating this very sophisticated medications that I give you the example. There is this disease that affects the children where in the spinal cord, their cells doesn't work at all. And when a child is born, within 6 months, they most probably will not be able to move at all. And some of them cannot even breathe. It's called SMA. So it's a genetic condition. We have treatment to the point that we can influence the gene and it stops working. And the child not survives, but actually thrives and walks and talks and can do a lot of different things that 3-year-old would be able to do. And literally 5 years ago, we were not able to offer this to the other children. We have a family at UNC where 2 children are affected and 1 child completely is normal, and all of them have the same genetic condition. So there's like amazing things that happen in neurology research, and there's amazing things that will be happening in the future. The way to get involved, I think, is to be connected to the community and to get to know what's happening. For example, American Academy of Neurology has membership for students, any student, including undergraduate student, and the membership is free. And the moment you're a member, you actually have access to a lot of different publications and a lot of different resources and news about what's happening in neurology and including research. So I would suggest everybody who's interested to participate. It's just American Academy of Neurology. You can Google it, become a junior member, and that way you will be junior neurologist. Billy, did I answer your question?
Yes, ma'am. Thank you.
You're welcome.
Our next question is from Alana Jones.
Hi. I'm at UNC Chapel Hill, and my question was about which medical procedures you perform during your career as a neurologist, and which procedures do you consult other doctors and other specialties for?
This is a very good question. So we perform a very old-fashioned procedure, right, Dr. Strowd, that's been around the block for 200 years, and we still do it the same way, called a spinal tap, where we basically get the fluid that runs around the brain and spinal cord to analyze. And because it's so intimately connected to the spinal cord and to the brain, by the analysis of this fluid, we can actually figure out what is happening. We can pick into what's happening with the brain and spinal cord. And this is a procedure that we do all the time. This is something that neurologists of from any subspecialty do. So that's kind of like very, very common procedure for us. We also do what's called muscle biopsy and nerve biopsy. And this is where we take a little small piece of the muscle or nerve and look under microscope what is the abnormalities there. This is very, very common. We're not completely planting the deep brain stimulation electrodes. This is usually done by the neurosurgeon, but we are the ones who map in the brain to really understand where this stimulation should go to. And after that, the stimulators are basically wires that go into the part of the brain that controls the movement, and then wires are under the skin, and people have this basically battery pack that looks like a pacemaker. And we actually can, this is a procedure, we can adjust the stimulation and improve patients' functioning by that. Dr. Strowd, what else we do? We do TCDs. We listen to, right? We listen to, with ultrasound, we listen to the different vessels of the brain and trying to understand whether they're patent and whether there's little tiny emboli in them. What else, Dr. Strowd?
I think you're right. I think, you think a neurologist just using their brains, but we use our hands a lot too. As you go through all those procedures, there's a lot of stuff that we do. And really those procedures are often an extension of our exam. And our exam is as much of a procedure as anything else to figure out what's going on with the brain and what's going wrong and how we can help it and can fix it. Great question, Alana. Thanks for asking that.
Thank you.
I think maybe we have time for one more, Susie.
Yep. Our last question is going to be from Mia Williams. Mia, you want to ask your question?
Yeah, hello. My name is Mia. I'm from Wake Forest. I just kind of had a question on what steps for an undergrad, I guess, that's interested in neurology to kind of take in that figuring out process, and how to kind of go about finding some exposure to neurology as an undergrad, maybe shadowing options, research, just things like that. Because definitely interested in the field, but I'm not quite sure where to look.
So I think Dr. Browner touched on that a little bit earlier when she talked about sending her 40 emails to different neurologists. And I think that that's a great place to start. Go on the Wake Health website and look at some of our doctors. And then you can start by just contacting us. We're going to have our email addresses available for you. And then you can go from there. You can do some shadowing. I would also recommend shadowing doctors in related fields. Like if you were also interested in psychiatry, I would do that too, so that you can get a sense of the different flavors. And definitely shadow more than one person. That'll help you figure it out. Just reading research will never do it for you. You need to get in the clinic and understand what it's like.
If I may add, Mia, so at UNC Chapel Hill School of Medicine, there's actually a shadowing office specifically created for undergraduate students and the students from other institutions. And if you just kind of like maybe Google UNC shadowing, it's available to you. You do have to take several classes, which are very easy to do online, especially HIPAA, since you will be in the clinic environment and we need to protect patient privacy, right? And then after those classes, you sign the form, and before COVID, you would have been able to come and shadow a neurologist in the clinic. With COVID now, it's a little bit trickier, but the offices of shadowing will be able to navigate it for you and tell you how it's done. And no matter how, you still have to do a little bit of the training to make sure that we protect patient privacy. A lot of us as a neurologist right now are doing what's called a telemedicine, which is teleneurology, where we're seeing our patients on platforms like Zoom. And I think that it creates not only improved access for the patients, but also may improve access for you as an undergraduate student that can peek into seeing the patient if any of the faculty member is open to do such thing, and if you are cleared by the shadow office.
Thank you so much.
Yeah, those are. Go ahead, Mia.
Oh, I was just saying thank you.
Thank you. That's a great question. And, you know, I think one of the things that that we hope with this session is that you walk away with some answers, but also walk away with some excitement to ask some more questions. And you have heard about some resources. So, Mia, I think that's a great kind of last question. The AAN, American Academy of Neurology, that is putting on this guest neurologist session is really interested in increasing interest and getting you all interested and excited about pursuing a field in neurology or any area of medicine, but we kind of like neurology. So do check out the AAN, the American Academy of Neurology. There's a ton of resources for everyone at all stages, including students. There are a ton of really phenomenal training programs in North Carolina. You all are in North Carolina. This is our North Carolina guest neurologist session, and so now you have 3 more faces in North Carolina that you know, and we would love for you to reach out to us. I know I would love for you to reach out to me. I think Susie and Dr. Browner would say the same thing, and so you got three extra folks in your corner, and please do feel free to do that. And a lot of our institutions do have opportunities for undergraduates. They look a little different now after in the midst of COVID than they did beforehand, but that doesn't mean there aren't opportunities where we can get you excited and interested or exposed to what it's like to be a neurologist. So Dr. Browner, thank you so much for joining us. Susie, thank you so much for joining us. We learned a ton from both of you about, you know, what it's like to be a neurologist, what a neurologist does, how you get there, what it's like to be on the path. So thank you both for joining us.
Thanks so much, Dr. Strowd.
This is amazing, amazing program. And all of you out there, please get into medicine. You will never, ever look back.
And where I'll end it is 2 things. If you will stay on and hear these last couple of things, which I think are really important. You know, one of the things that you've seen is neurologists come in all different shapes and sizes. And so no matter who you are or where you are, you can get into this field. And we really want to encourage you to do that. It is a diverse field. It is with a lot of things you can do and a lot of people that we need to help us with those patients. So I hope you have seen a glimpse of that today. If you would please give us some feedback about this session. We are very interested in how this went for you. We're working on the program. This is our first session, so you all are the first to get this, but also to help us to improve the program as we continue to take the guest neurologist elsewhere and maybe even back around to North Carolina soon. So thank you all very much for joining us. Please fill out the survey. We really, really would appreciate your feedback. Email us if you have any questions or if there's things that we can follow up with you about. And we look forward to seeing you in a neurologist chair sometime soon in the future.
Thanks, everybody.
Thank you so much. Good luck with everything.